This topic is human immunodeficiency virus, otherwise known as HIV. HIV is a retroviral infection, meaning that it uses an enzyme within the cell called reverse transcriptase to help make more viruses. When HIV transfers its single-stranded RNA into the cell, reverse transcriptase will generate a complementary strand of DNA. This complementary strand of DNA will be integrated into the host cell's DNA. From here, this DNA will become transcribed, leading to the formation of viral proteins and generation of new viruses. These viruses will then bud off from the host cell and go on to infect other cells. The surface proteins of the virus have a special affinity for CD4, a receptor protein on the surface of certain types of white blood cells. The virus will bind to and proliferate within CD4 cells, especially helper T cells, for quite some time. Ultimately, a cell that has been affected by the virus will become destroyed after a certain period of time. Many CD4 cells are responsible for helping us mount and maintain an immune response, as well as stopping the proliferation of abnormal cells within the body. Therefore, their destruction over time leads to an increased risk of developing opportunistic infections, as well as some types of cancers. There are 3 stages to HIV infection. The first stage is the acute phase, which happens about 2 to 4 weeks after initial exposure. In this stage, the initial viral count increases significantly, while the amount of CD4 cells within the body may stay normal or just dip slightly. Towards the end of this stage, the client's immune system will be capable of reducing the overall viral load to relatively low levels. However, due to the nature of the virus, the client has now become infected chronically and will carry this infection for the rest of their life. This leads us to the second stage of HIV infection, which is the chronic stage. This stage follows the acute stage and is characterized by a slow but steady increase in the viral load count within the body and a slow and steady decrease in CD4 cell count. Depending on how quickly the virus replicates within the body and how fast CD4 count drops, the time between the acute stage and possible development of AIDS can take a few years or up to 10 if the client is left untreated. The third and final stage of HIV infection is the development of AIDS. This is when CD4 count drops to such a dangerously low level that normally non-lethal infections can become very deadly. Let's talk about the ways that HIV is and is not transmitted. Transmission can occur commonly through blood-to-blood exposure, especially through the use of shared needles or needle stick injury. Unprotected sexual contact, which can lead to transmission of infected semen, vaginal secretions, and blood to an uninfected individual. And perinatally, meaning that a mother can pass on the HIV infection to their child. Now, this can happen during childbirth or during breastfeeding. It's important to note that HIV is not transmitted through urine, emesis, sputum, feces, sweat, or respiratory droplets. Regardless, if we are anticipating coming in contact with any of these types of secretions, we want to make sure that we are wearing appropriate personal protective equipment. Clients that are at an increased risk for developing HIV infection include those having sex with high-risk individuals, IV drug use, blood transfusions, which is very rare at this point in time as most labs are checking and assessing for the presence of HIV in blood specimens, but it is a possibility. Healthcare workers are also at an increased risk due to the possibility of needle stick injury and exposure to blood or blood products. And babies born to mothers who are HIV positive. Let's talk about the clinical features of initial HIV infection, essentially what symptoms happen during the acute stage. CD4 cells are found in many different parts of the body, so we can expect the client to have symptoms that are similar to the flu or mononucleosis, essentially symptoms that are generalized and systemic. Most likely, the client will have a fever, could develop a sore throat, have enlarged lymph nodes, and may develop myalgia, which is muscle pain, and arthralgia, or joint pain. The client can develop a generalized maculopapular rash and may have some gastrointestinal symptoms such as nausea, vomiting, or diarrhea. If the client has had a known exposure or if HIV exposure is highly suspected, we can help make a diagnosis by drawing a blood sample and measuring for high viral load counts. Typically, a count that is greater than 100,000 copies of the virus per milliliter is associated with HIV infection. In this acute stage, HIV antibody testing may be negative. This can happen because the body has not had enough time to generate antibodies against the virus. And CD4 count may be normal or just slightly decreased. At the beginning of the chronic stage, clients who are HIV positive may be asymptomatic for a few years following initial infection. It's very important to teach these clients that even though they may be asymptomatic, they can still pass the virus on to others. Therefore, they should be educated over appropriate precautions to prevent transmission. As the CD4 count decreases and viral load increases, the clients can become symptomatic and may develop such symptoms as persistent fever, recurrent headache, fatigue, night sweats, and chronic diarrhea. Because HIV attacks cells that are important for mounting an immune response and fighting off infections, clients who are positive for HIV can develop significant immune dysregulation, which can lead to the development of opportunistic infections and cancers. Opportunistic infections are those infections that take advantage of a weakened immune system. And these include such things as candidiasis, which is a fungal infection that can affect the vagina or the mouth. Oral candidiasis, also known as thrush, is depicted here in this image. And as we can see, it appears as white patches on the tongue and on the inside of the cheek. Other opportunistic infections include oral hairy leukoplakia, which is caused by the Epstein-Barr virus, pneumocystis pneumonia, tuberculosis, and if the client had chickenpox as a child, they may have reactivation of the varicella-zoster virus, which leads to the development of shingles. Opportunistic cancers occur due to the body's inability to control and remove abnormal cells. Common cancers that can develop for clients who are HIV positive include Kaposi sarcoma and certain types of lymphomas. As the viral load continues to climb and more CD4 cells get destroyed, this can lead to the development of AIDS. AIDS is typically diagnosed when a client is known to be HIV positive and has one of the other following characteristics: a CD4 T cell count of less than 200 cells per cubic millimeter, or 0.2 times 10 to the 9th cells per liter, has an opportunistic infection such as candidiasis, pneumocystis pneumonia, or tuberculosis, or has an opportunistic cancer such as Kaposi sarcoma or, again, certain types of lymphomas. The image on the right side of this screen shows us what Kaposi sarcoma looks like. It appears as a non-tender, reddish, purple, ovoid plaque that is found on the skin. Nursing interventions for a client who is HIV positive focus on preventing transmission, minimizing viral replication, and maximizing the body's immune response to prevent opportunistic infections and cancers. HIV is a reportable infection that requires tracking when it comes to public health. Therefore, we should report any new HIV diagnosis to the public health department. During this time, we should prioritize client confidentiality, as this diagnosis can be very personal and can be difficult for the client to process. Therefore, care should be taken to maintain the client's privacy when they are first told about the diagnosis. That way, they can make sure that they are in control when it comes to relaying that information to friends or family. A pregnancy test should be obtained to rule out or confirm pregnancy, which is important as the mother can pass on HIV to the fetus or child. When it comes to providing client care to those who are HIV positive, we only need to employ the use of standard precautions. This means using gloves when we provide client care, wearing eye or face protection if contact with secretions is anticipated, and using a disposable gown if we anticipate the splashing of bodily fluids. Standard treatment for HIV includes the use of multi-drug antiretroviral therapy, also known as ART. ART will not cure HIV infection, but it will work to decrease the viral load and increase CD4 cell count. For clients who are HIV positive, ART is lifelong treatment, even if viral loads are undetectable. The client should make sure that they take ART medications over the course of their life to prevent a resurgence of the viral load and prevent HIV from progressing to AIDS. Additionally, the client and healthcare provider should go over the client's medications, as certain medications and supplements can affect the absorption and effectiveness of ART, such as certain over-the-counter medications and herbal supplements. We want to be proactive when it comes to infection prevention for these clients, which means making sure that the client is up to date on their vaccinations. This includes yearly influenza immunizations, as well as making sure that they're receiving their pneumococcal vaccines. We want to test for exposure and immunity to the hepatitis A, B, and C viruses. We also want to prevent contact with cat feces, as this is known to carry something called toxoplasmosis, which can lead to an opportunistic infection. Additionally, we want the client to avoid the use of aquariums in their home, as these can carry certain animal pathogens that come from frogs and fish and other types of animals that use these habitats. Clients should avoid large crowds or individuals with known infections, as well as any potentially contaminated water sources, such as rivers and wells, and make sure that food is cooked thoroughly and avoid raw or undercooked foods. One way that a client can make sure to use appropriate water sources is to use bottled or purified water when it comes to drinking or brushing their teeth. And the client can use a food thermometer to make sure that foods are cooked to the appropriate temperature prior to consumption. After all of this, if symptoms of an infection do occur, the client should report that immediately to the healthcare provider. Headache, vomiting, and mental status changes may be indicative of a cryptococcal or toxoplasmosis infection. Rash or abnormal growth on the skin could be indicative of Kaposi sarcoma. More than 5 to 6 loose stools in a 24-hour period is associated with Cryptosporidium infection. Cough and dyspnea could indicate pneumocystitis pneumonia. And visual changes are associated with cytomegalovirus retinitis. Abnormal change from the client's baseline could be indicative of an infection and should be reported immediately to the healthcare provider. For clients who are HIV positive, we need to teach about preventing transmission of HIV. Remember, HIV is commonly transmitted through contact with infected semen, vaginal secretions, and blood. Therefore, the client should use appropriate barrier methods, such as condoms, with all sexual partners. Recent sexual partners should be informed of the client's HIV diagnosis so that they can also be tested. Once a client has been diagnosed as HIV positive, they should not donate blood or semen. And they should not share toothbrushes, razors, or other items that may intentionally or accidentally draw blood. Again, antiretroviral therapy is for life. Clients should be reminded of the importance of medication adherence, and they can remember to take their medication by using a pill box, setting notifications on smartphones as to when they should take their pills, and by placing their medications close to items that they would use daily, such as a toothbrush. In this way, they can take their medication before or after they brush their teeth, which is something that should be occurring daily. And a high-calorie, high-protein, low-residue diet helps the client maintain energy levels, keep their immune system healthy, and prevent gastrointestinal complications like diarrhea. To reduce the risk of HIV infection, pre-exposure prophylaxis for high-risk individuals includes oral or injectable medications that can prevent HIV from entering or replicating within CD4 cells. These medications are not 100% effective, but they do decrease the risk of HIV infection. Therefore, the client should use other prevention techniques, which includes the use of condoms, regular HIV testing, and safe needle practices for injection drug users, which includes safe disposal of needles. Post-exposure prophylaxis is something that commonly occurs in the healthcare setting following a needle stick injury. When a needle stick injury occurs, the healthcare provider should follow agency protocols as well as washing the exposed area thoroughly, reporting the needle stick injury to employee health to test for HIV exposure, taking antiretroviral therapy as soon as possible, meaning in less than 72 hours following initial exposure, and taking that antiretroviral therapy for up to 4 weeks in order to prevent HIV infection. For maternal fetal transmission of HIV, transmission of the virus can occur at any point during pregnancy, which includes the antepartum, intrapartum, and postpartum periods. HIV can also be transmitted through the client's breast milk to the infant during feedings. To reduce the risk of transmitting HIV to the fetus and newborn, the mother should take maternal antiretroviral therapy during the course of their pregnancy. Some mothers may still be concerned that they could transmit the virus to their newborn even in the absence of bodily fluids. In this instance, we should make sure that we are encouraging our mothers to have that skin-to-skin contact with their newborn, as this helps to promote bonding and will not lead to transmission of the virus. And the infant should receive prophylactic ART for 4 to 6 weeks following birth to prevent maternal transmission of the virus to the infant.